Thank you so much for joining us. Today we're going to be interviewing a current Doctor of Chiropractic student, soon to be Dr. Chelsea Durling. Thanks for joining us, Chelsea. To get started, I'm curious if you can tell everyone who's attending what led you towards chiropractic and then how you ended up choosing the University of Western States.
So mainly the chiropractic choice kind of came through my own personal experience with a lot of injuries over the years. And I kind of found myself wanting to give back and be able to help other people out. And so I knew that I wanted to kind of come at it through kind of a whole body approach. And that kind of came just from me having a ton of different injuries just all over the place and knowing that one injury can really affect kind of somewhere else. And so I started looking into, what avenues I can start going down. And so I was kind of looking at chiropractic, and it's kind of a whole body approach, and it's a very hands-on profession, I guess. And so I liked that it had a lot of manual therapy and then a lot of rehab if you want to go that route as well. And so I felt that was what I wanted to do. And so I started looking at schools, and I was drawn to UWS because it has a very patient-centered, evidence-based approach to it. And I found that to be super important in my future career. And so that kind of is where it led me with that.
Awesome. So remind me again, what term are you in right now?
I'm in Q9 right now.
You're in Q9. So you're already in the clinical portion of the program.
Yes. I've been in here for a couple months now, or a couple quarters, sorry.
Yeah. How is that going so far?
It's been awesome. I feel like the school's done really well in terms of trying to keep our education going, especially during the COVID times. And so honestly, we've still been treating people as normal and that sort of thing. And we're just kind of cleaning a lot more, wearing masks, just that sort of thing. But overall, it's been really good in the clinic.
I'm so glad to hear that. And kind of looking back so far on the program, your first 8 terms before this one, what was your favorite course so far?
I think my favorite course was probably the cadaver lab. And as weird as that is, it was kind of nice just to be able to literally see like what you're learning in class and kind of being able to put those puzzle pieces together, because those gross anatomy classes you take, you just learn so many things, like just loads of stuff. And so it really helps to be able to like literally connect, what's going on.
Yeah, that makes a lot of sense. It probably is a good foundation for the rest of the courses that you've taken since then.
Yes, of course.
So I'm curious to, up to this point, like when you first started at UWS, what was your biggest challenge? Because you went from undergrad directly into the Doctor of Chiropractic program. That's a huge change.
Yeah, it was definitely a big change. I think the big thing was literally just trying to find a good balance, the work-life balance. And to be honest, it was hard the first quarters, like the first couple quarters, because you're wanting to focus on your studies, and those first couple quarters is all your really basic sciences, and they're so important. But slowly I really tried to set some boundaries for myself in terms of how much I'm studying and really being able to explore Portland a bit, because Portland's a lot different than the city that I grew up in. So it was nice to finally get out and see it.
Good for you. And so remind us, where did you grow up?
I'm from Calgary, Alberta, Canada.
Okay, so what was it like coming into Portland from after living in Calgary?
Well, I'll preface it by saying that Alberta's a bit more conservative than Portland, so that was a big change to begin with. And then on top of that, Portland's just a lot different of a city in terms of it has so many little neighborhoods that have their own, little street of shops and bars and, things to do. And so that was really cool, being able to literally go to one neighborhood one weekend, and then a couple weekends later you go to a completely different neighborhood. So that was really awesome. I really also like that there's so much hiking, outdoor stuff you can do. Like you literally have Mount Hood on one side, and then the other side you have the ocean a couple hours away. So that's pretty sweet as well.
Yeah, I wholeheartedly agree. And during the summer, the amount of events around town are ridiculous. Like every neighborhood's having a street party, and there's like Pedalpalooza and Sunday bike parkways for bicycling and stuff.
Yeah, I remember one of the things that I always tell my friends back home is about the burger week that they have here. and how essentially there's a bunch of bars that are going on with this, and it could be burgers, tacos, pizza, could be anything. And so different bars take part in this, and it'll essentially be like $5 for a burger, and you can try all sorts of different burgers. Like they put all sorts of random toppings on these burgers, and it's so cool to try. And it's a kind of a fun thing to do in the evening. Like we'll finish class and there'll be a group of 4 or 5 of us that'll go and hit up whatever bar it is and try that burger. So that was kind of fun.
Cool. So since you moved all the way from Calgary to Portland, besides the change from it being like a little less conservative here, were there any challenges to moving down to Portland? Like, were there some changes that were hard to get used to?
I found some of the weird changes that, like, one of the biggest ones that I was not used to was that in Oregon, you can't pump your own gas. And so that was kind of weird, to just kind of have somebody come up to your window and, and that sort of thing.
Yeah, that's true. It is a regulation here that you have to let the person at the gas station pump your gas for you.
Yeah, so that was very weird. Another thing that I found odd was just like if you're in a restaurant or something back home, they kind of bring you the device, like your debit device, and you kind of, pay that way instead of literally giving your card away and hopefully they come back with it.
Yeah, that's true.
The gas station, right?
Yeah, the waitresses will take your card and then process it and bring it back to the table.
Yeah, I'm like, I hope they come back with that card, I think the other one is that you need to be a good defensive driver in the city. And then I found that the driver's a little crazy here. And then as well as the merging was the big thing for me, and how they have traffic lights that tell you when to merge. And so I found that very odd that people don't know how to merge and they had to put traffic lights to help people. So
yes, that's mostly on the freeways, but there are lots of really great bike routes, and
yes,
those are fantastic to ride if you are a biker. But yeah, the freeways can be challenging.
Yes.
Yeah, so I have some more questions for you related to your move down to Portland. So how did you first find housing when you got here?
So I first found housing from you, in fact, and all of your help. So is, I would say, most of my classmates. And so if people that are watching, if you don't know, Natasha will essentially add you to a Facebook group, and she's done an awesome job at searching up some housing things, and she'll send links and that sort of stuff, and you can kind of look there. But it's kind of just a cluster of finding who you want to be with. And I know there were some people in my class that would almost have kind of interviews with potential roommates because nobody knows each other. And so sometimes there'd be somebody who's like, hey, I found this house that has, 3 bedrooms. Is there 2 people that want to come with me? And that's just kind of how you come together. And, if it doesn't work out, then you change it up in a year. It's, it's a learning experience. It's a whole experience, So.
Yeah, and there's still the benefit of you're studying in the same program, so that person's going to be able to help you figure out like what you're supposed to remember for that particular exam, or what date you're supposed to have it on.
That is helpful. You can kind of just ask them, we have that exam tomorrow. Is that tomorrow? Or is that in 2 days from now? It is helpful, I will say. Kind
of a big deal. So I'm curious too, while you've been in the program, have you been a part of any particular clubs that you liked?
I did do a lot of clubs, actually. I found that was a good way to spend my time at lunches and that sort of thing. And, you're sitting down in class for, 6, 7 hours a day, right? Like you kind of just want to get up and move. And so most of the clubs that I did were kind of the lunchtime clubs, and they were kind of more the hands-on. Either there's a rehab club, a soft tissue club, a adjusting club. I also went to a business club that was, what time is it? 6:30 in the morning on Mondays. So that was a bit of a rough one. That was nice to kind of learn a bit more of the business side of things. So,
are you feeling now that you're in 9th quarter that you're learning more about the business side from some of your classes as well?
We just did a business class actually with Dr. Cooper, and that was an awesome class. And I know a lot of people felt very appreciative for it, just because we haven't done much business stuff since then, but I'm pretty sure we still have a few more classes still to come.
Definitely do.
That's good, yeah.
Was there anything in particular that she covered that was really important for you planning your future career?
I don't know. It's kind of just a general, like, these are the things you should look for, these are some of the contract things you should do. And then I also just finished a jurisprudence class, so that's kind of the law and ethics, and that's kind of, your malpractice insurance and that kind of stuff. But mainly the business class we took was a lot of sort of like advertising, and like we did a lot of discussion posts, which I think a lot of people found quite useful, because he would post things such as, you walk into a clinic, what do you want your clinic to look like? Like, how do you picture it? So it's kind of cool to kind of put yourself in that position.
And kind of think big picture and long term.
Yes,
So
exactly.
you can start planning ahead for it.
Yes, exactly. Instead of just books.
Yeah, I know. This is the perfect time to start thinking about it. So kind of on that same note, have you envisioned your future practice or kind of thought about next steps for getting there?
It's honestly, I'm not entirely sure. I've been thinking about if I want to stay here for a little while, if I want to go back to Calgary. And I found that COVID has made it difficult in terms of trying to reach out to places and do some job shadowing and like finding a good fit. But I have found that a lot of doctors in practice have been open to having some Zoom calls and that sort of thing. And so you're trying to get to know people a little bit as much as you can.
Yeah.
And so I've kind of been doing that. But honestly, I'm kind of open to whatever comes my way at this point.
But it sounds like you're still looking at more of a general practice and not like sports rehab or pediatric or anything really niche.
Yeah, I think it'll be kind of general, especially to start out.
Yeah.
And then we'll see if it goes one way or the other.
Great. Well, let's see. I'm trying to think if there's any other questions that I have for you. I think that was everything that I had planned to ask. Is there anything else that, like any advice you would like to share with a prospective student or incoming student?
Any advice? I think this program is you make it what you want, Like I know some people that really took the time to, go and explore Portland. And I know some people that really wanted to have more of a school-based approach to it and wanted to focus on their studies. And so you make what you can of it. Like I've made some of my best friends in this program, and I never expected that to happen out of it. And so it's really, you'll have your hard days, you'll have your better days, and it's you got to go with a positive approach, and it'll all work out.
Yeah, and you're not the first one to say that about making some of your best friends. I hear that often, that some lifelong friends are made in the program. I think both because of the challenges and the amount of time that you spend on it and the shared interests, like in the human body and caring for other people, just creates this really intimate program where everyone's really connected.
Yeah, I completely agree. You kind of bond on the level of the amount of stress that you're going through.
Yeah. Well, Chelsea, thank you so much for joining us today. And maybe we'll do another interview here in the near future, but I really appreciate all that you've had to share with our prospective students.
Of course, my pleasure.
Okay, see you again. Bye.